So good morning, everyone. My topic for the day is impact of the COVID-19 pandemic on eye care services rendered at our institute. Introduction: the coronavirus disease, the 2019, the COVID-19 is a novel disease which started in the Yuan, China in December 2019. The World Health Organization declared the outbreak a public health emergency of international concern on 30th January 2020 and a pandemic on 11th March 2020. The first case of COVID-19 in Karnataka was reported on 24th February in Bangalore. The nationwide lockdown in India was announced on 25th March 2021 for a period of 21 days and only emergency healthcare services were functioning. The lockdown 2.0 was started on 14th March to the 3rd May. The government of Karnataka further announced the lockdown 3.0 till May 17, 2020 and the elections were formulated based on conducting the risk profiling of the various districts. The COVID-19 outbreak forced the entire country to focus on providing emergency care in order to treat the high number of cases in a short period of time given the quick spread of the virus. This forced several other health services to suspend activities which left a high amount of chronic patients without the medical assistance. The aim of this study is to assess the impact of the 3 COVID waves on elective and emergency services provided by our tertiary care center. The services were compared to those rendered prior to the pandemic, during the COVID waves and post-pandemic, the period upsurge. Objectives: in order to compare the total number of eye care services rendered and total number of patients evaluated in our tertiary care center prior to pandemic, during the 3 COVID waves and the post-pandemic. The materials and methods: source of the data was from the medical records department of our institute. The study period was from January 2019 to September 2022. The place of study: Regional Institute of Ophthalmology, Mento Ophthalmic Hospital, Bangalore Medical College and Research Institute, Bangalore. Methodology: monthly data were collected on number of eye care services rendered and total number of patients visited to tertiary eye care center from January 2019 to September 2022. The data was tabulated into 5 parts, namely pre-pandemic period January 2019 to December 2019, during COVID wave 1 March 2020 to October 2020, during the COVID wave 2 March 2021 to January 2021, during COVID wave 3 January 2022 to February 2022. The post-pandemic period was taken as March 2022 to September 2022. The descriptive statistics applied among the groups and data were tabulated and represented in the graphical format, following which to assess the statistical significance, the data were combined into 4 groups, namely Group A 6 months prior to the wave 1, Group B 6 months prior to the wave 2, and Group C 6 months prior to the wave 3, and Group D 6 months post wave 3. The statistical analysis was done and significance was assessed. Moving on to the results, the graph 1 showing the average number of eye care services rendered monthly during the pre-pandemic period and during the COVID wave 1 and during the COVID wave 2 and during the COVID wave 3. Graph 2, monthly average data of healthcare services rendered during the year 2019, that is the pre-pandemic and during the COVID wave 1. The graph shows this graph shows the major decline in all the eye care services rendered during the COVID wave 1 as compared to the pre-pandemic period. Graph 3 is the monthly average data of eye care services rendered during the pre-pandemic period and during the COVID wave 2. The graph shows major decline in all the eye care services rendered during the COVID wave 2 as compared to the pre-pandemic period, but it's better than the COVID wave 1. Then the graph 4, the monthly average data of eye care services rendered during the pre-pandemic period and during the COVID wave 3, the graph shows the similar data regarding the average monthly eye care services rendered during the pre-pandemic period and the 3rd wave. The 3rd wave did not have any deleterious impact on the eye care services provided at our institute. Monthly average data of eye care services rendered during the COVID wave 1 and COVID wave 2 was also compared. The graph shows the eye care services rendered by our institute declined in both the waves, but decline during the first wave was significant more than during the second wave. Following which, to assess the statistical significance, the following groups were done. ANOVA test was applied between the 4 groups. Within the groups, and statistical significance was assessed. For the data which weren't significant between the 4 groups, the Kruskal-Wallis test was applied. The data found to be statistically significant with p-values less than 0.05 between the 4 groups in all the services rendered. The data also showed an upsurge in all the services rendered at our eye care center during the post-pandemic period as compared to the pre-pandemic period, and it was statistically significant. Discussion: COVID-19 is a novel disease caused by SARS-CoV-2 RNA virus. Due to the increased fatality rates and communicability of the disease, the lockdown was initiated throughout the country, and majority of the period during this time, the eye care services were only allowed to render the emergency eye care healthcare and COVID-related services. Due to the nationwide lockdown, transport facilities were also curtailed, posing difficulties to people in rural India requiring eye care services. As many eye care services rendering insurance were converted to COVID care center, this indicated the fever among the community, and in turn, they hesitated in utilizing eye care services. For all the above said reasons, there was significant decline in the various eye care services provided by our tertiary care center during the COVID waves. Thus, it resulted in the loss of monitoring regarding the treatment compliances, failure in the regular follow-ups, resulting overall decline of the proper eye care. Thus, as there is significant decline in the ophthalmic care services provided during the 3 COVID waves of COVID-19 pandemic as compared to pre-pandemic period, significant upsurge in the services rendered post-COVID wave 3, the government and lawmaking authorities should come up with effective measures to the backlog cases which were deprived of the services due to lockdown of the COVID waves. The telemedicine technologies can be brought into practice, thus outreaching all the eye care services even to the remote areas. Thank you.
So during the pandemic, was the telemedicine being practiced at your hospital?
It was not practiced, ma'am.
It was not
It
practiced.
was not practiced, ma'am.
And emergency services?
Emergencies, ma'am, it's like it's in the RIO is in the college, ma'am. So people had the fear that the rest of the part, other than the eye care center, was converted into the pandemic hospital. So other patients were not treated over there. So people had the fear that they might contact the COVID patients. So they were not visiting, ma'am.
So no emergency, nothing was
No
done
emergency during the COVID wave.
at least first wave there was
first
nothing.
wave there no emergency was done, ma'am.
Second, third wave, as
Second
you
and
showed
third,
in the,
yeah.
some cases were taken care of. How about the surgical load during that time? Was there any emergency surgeries, perforations, and was done or no?
Emergency cases, like they were not reported only, ma'am. Like during the
Their patient
first
did
of the
not
COVID
come.
wave, at least to our hospital centers. During the second of the COVID wave, wave 1, they started reporting, ma'am. All the corneal tear repairs and the phacomas and all, we started doing, ma'am.
Okay, thank you.